practitioner. I wanted to make sure people understood the macro pieces of this as well. So I wanted to, without boring you to tears, talk about some of the challenges, both from a policy perspective in implementing clinical policies, as well as working to change clinical policies. So there it is. So as Lynn said, I'm John DeJoy. I'm on faculty at the University of New Hampshire, teaching macro practice, and I'm working with the chapter on their legislative advocacy. So for today, and if this screen is too light, please tell me. It is very light. The type is very light on my screen. You're going to have to unmute to tell me, and I'll try to do something with the type if you're having trouble seeing it. So for today, these are the learning objectives that you can take a look at, and what we're hoping that you're going to take out of this workshop. So to try to understand what I'm hoping to cover today specifically, I'm going to talk a little bit about the context. It's important we all start with a frame of reference, and so I'll talk about the context for the pandemic. I'll talk a little bit about the various policy levers that have been utilized throughout the crisis. I'll talk about specific policy responses, both on a federal and a state level, things that you're probably much more familiar with, where I can share some about how some of those things came to pass, and wrap up with a discussion of advocacy during this time and what some of the challenges and some of the opportunities are around advocacy, and close out with questions and answers. Lynn had mentioned the Q&A. I'm hoping to save about the last half hour for questions that people have. Lynn, when I'm on full screen like this, I'm not able to see the chat very easily. So if people have clarifying questions, would you please interrupt me and let me know? If there's something I say that's unclear, I'll try to clarify it throughout the presentation. If it's more an elaboration, I'd prefer to wait till the end to discuss those types of things.
I'll keep an eye on the chat.
Thank you, Lynn. So, as I said, we're going to start with context. And so what is the context of this pandemic? And let's be sure we're all on the same frame as we're talking about it. So just to run through the timeline really quickly, I'm not going to spend a lot of time on this. I'll let you read through it, and I'll make these slides available for folks. But so December 31st of last year, 2019, that's where the 19 in COVID-19 comes from, China reported a cluster of pneumonia-like illnesses to the World Health Organization. And we experienced in the United States the first known case of a positive COVID test on January 20th in Washington State. During February, the CDC announced an expectation of severe disruption of daily life. The end of February, we saw the first US death, also in Washington State. So in March, we really begin to feel in New Hampshire the initial and then full impact of the COVID crisis. The first case in New Hampshire was in early March. That was a person who had traveled. But then 2 weeks later, the legislature suspended all in-person activity. The first death was the end of the month, and the governor issued the stay-at-home order by the end of March. So you can see things ramped up very quickly in March. I know for myself, March feels like so long ago. It was helpful for me to look at this to understand exactly how this evolved. In April, early April, for perspective, we had about 400 cases and 4 deaths. New Hampshire began planning how to spend discretionary CARES funding. We see an uptick in unemployment and stores closing, and by the third week in April, New Hampshire has established a task force to begin to look at reopening the government less than a month after the governor had issued the initial stay-at-home order. In May, the 1st of May, we had over 2,300 positive COVID cases and 81 deaths. You can see how quickly we escalated. May 11th, which was yesterday, retail and hair salons were permitted to reopen, and next Monday, restaurants will be reopening. I'll talk a little bit about that when we get into some of the policy levers. So what about New Hampshire and the COVID cases that we have? So the department has been helpful in issuing daily updates, which I've been tracking. What you're looking at here is a week-by-week graph of new positive COVID cases. These are only tested positive cases, not presumed positive cases. And you can see that we are still going up in terms of cases. The most recent week was last week. We're over about 535 or so cases, slightly up from the week before, significantly up from early April. So we are still going up in terms of new COVID cases. One of the complicating factors in this, and it's unclear exactly how this is showing itself, but one of the complicating factors is we've also increased the amount of testing that the state is doing regarding the reopening. So there's more testing of COVID cases. And so that is likely having an impact on positive cases. We're just not clear what kind of impact it's having at this point. But this may help give some perspective. So the tall blue lines are new hospitalizations over the same time period. You can see in the first 2 weeks, there were no reported hospitalizations, no reported deaths. And you can see that hospitalizations appear to have peaked during early to middle of April and appear to be coming down, not a straight line down, but appear to be coming down. We'll have to keep watching the data to see if this is accurate, especially in light of the more positive cases. The brown line is the number of deaths in New Hampshire. We're currently, those are new deaths, not cumulative deaths. We're currently up over 130 deaths in the state right now. And deaths are still increasing. But remember, death is a lagging indicator to hospitalization. So hospitalization is really one of the key indicators we want to look at, because if people are ill enough, they'll be winding up in the hospital. So how has the government, on a macro level, how has the government responded? Well, we'll look at 3 different types of responses that the government has undertaken. There's a federal response. We'll look at the New Hampshire executive branch response, or the governor and the agency's response, and then the New Hampshire legislature's response to the crisis. So the federal response. We're all aware Congress has had a very difficult time for the last, well, almost decade at this point, a very difficult time moving things forward, accomplishing things because of the partisan divide within the Congress. And that has, in fact, been present during this time. But since the first week in March, 4 separate pieces of legislation specific to the COVID crisis have all been passed. The first one is referenced there March 4th. That was, and it seems quaint now, only an $8 billion appropriation. That was for vaccine development, purchase of personal protective equipment. The next one, the first significant act affecting the public, was on the 18th of March, the Families First Coronavirus Response Act. That is the act that established paid leave for people who were uncomfortable working or unable to work because of positive symptoms. It increased unemployment insurance benefits, added food security for folks who were newly unemployed, increased Medicaid funding. So some fairly significant, and that was about $98 billion. The CARES Act, the end of March, the CARES Act is the big one, the $2.2 trillion act. I'm not going to go into a lot of detail on that because it's been very well chronicled. But that is the act that has really the meat and potatoes of what Congress has done to try to help individuals and states deal with the excess expenditures relative to this current crisis. And the final act there, which was 24th of April, is an extension of the CARES Act. It added more money for small business loans, added more money for hospitals. And so that is the crux of the federal response. There is currently another bill, what I'm referring to as CARES 4, for lack of a better name, that is likely to move through in the next week or two. It's unclear exactly what that will look like, but that is in process as an additional federal response. So how has New Hampshire responded? So I mentioned previously the governor issued the stay-at-home order on the 27th of March. Previous to that, the governor declared an emergency order. The purpose of the emergency order gave him extraordinary powers, and it gave him the ability to make unilateral decisions where he didn't need to include the legislature because of the extent of the emergency, such as issuing a stay-at-home order. The governor has issued, I believe the latest count is 41. He's issued about 41 emergency orders that are the crux of the policy changes that we'll be talking about in a few slides. The emergency orders are developed by him and his staff, and they don't need any other approval. The other thing that that New Hampshire has done is to develop task forces. So I mentioned before the governor began looking to reopen the state in late April. So he developed a task force for that in late April called the New Hampshire Reopens Task Force. They've been meeting every day at 3 o'clock for the last several weeks to look at the impact of reopening, how to reopen safely, what are the needs for reopening. And it's been handled, it's moved quickly, but it's been handled in a fairly professional manner. The one complicating factor is that it's primarily, the membership is primarily business owners who have a vested interest, but the governor's policy staff is on that committee as well. So they've been talking about how to safely reopen the state. And there's been another task force with an unfortunate acronym. The acronym is GOFER. It's the Governor's Office of Economic Recovery, who are advising the governor on $1.25 billion in discretionary state spending that came to New Hampshire as part of the CARES Act. That can be used for pretty much anything except for replacing state revenues. That's another meeting that has been happening every day for the last several weeks to take a look at how it is that we're going to spend this money. What is the most effective way? What can we do to most effectively assist the people and the state of New Hampshire to keep moving ahead during this significant economic downturn? So I did say that I would talk about the legislature and the legislature's response as well, and they're not included on this slide. The legislature is in a very unusual situation. The emergency declaration, as I said, gave the governor extraordinary powers. No longer needed the legislature to change statute or to issue essentially new statute under the emergency orders. The one complicating factor is that emergency orders all expire when the emergency declaration or the state of emergency is removed. All the emergency orders go away unless they have a shorter time frame. So the governor has reissued the stay-at-home order a couple of times because he's doing it for small chunks of time. So the legislature has had a very difficult role in all of this. They have not been meeting. The legislature has found it very difficult to meet online as much as we meet on Zoom because of public meeting notices, public meeting requirements. The legislature has struggled to meet online, um, which is where they would likely have done most of their business. They've begun meeting recently, but there are one or two committees handling, a couple of bills a week. So effectively, all legislative work has stopped in mid-March, which really takes the legislature out of the picture. There is a legislative committee referred to as the fiscal committee that it typically, when the legislature is not working, handles all money issues, all appropriations, spendings, budget transfers. The governor has contended that the fiscal committee has no role during the emergency declaration. The fiscal committee has contended that they alone can appropriate money, not the governor. This is the court case that you probably heard about, where the legislature has sued the governor for overreaching on his constitutional powers. The case was thrown out by the judge, not on the merits, but it was thrown out because the legislature was deemed to have no standing. I'm not going to try to explain standing to you as a non-lawyer, but essentially, as I understand it, the legislature had no place, no business, no right to sue the governor because they didn't like what he was doing, is the ruling of the court. That is currently being appealed. But in the meantime, the legislature is really on the sideline in most of this conversation. It's unclear when they'll return. Lots of rumors, lots of conjecture. I'll talk about that a little bit more in a bit, but it has been very difficult for them to figure out how they fit in this time. So let's move on specifically to the policy responses that have come about. And let me talk about them a little bit and try to explain where specifically they came from. So the first policy response that I'm sure most everyone on this Zoom is familiar with is telehealth. So telehealth was included in one of the congressional bills. The NASW, the national, was very involved in making sure that telehealth was available for through CMS, Medicare and Medicaid, and that it was a billable service to provide ongoing mental health care, given that people were not going to be able to come to see most of us in offices, given the lockdowns that were occurring at the time. So they were instrumental in moving that forward. Beyond that, the governor, through an emergency order, also authorized telehealth because federally it was authorized for Medicare and Medicaid, which is a good start. Medicare, interestingly, only initially authorized video telehealth. Audio telehealth was not part of the Medicare coverage that was negotiated at the congressional level. The governor, through Emergency Order 8, authorized telehealth. And he authorized telehealth very broadly, listed a number of types of professionals, wasn't just medical. He listed mental health professionals, listed social workers specifically, mental health counselors, listed a large swath of the community providing mental health care to be able to continue working with clients. And one of the most important pieces of this in the emergency order was that the governor directed that insurance companies will compensate professionals as if the sessions happened in person, so at the in-person rates, and went further than that and actually prohibited insurance companies from charging co-payments and deductibles on COVID-related services. And so this became a question of what is a COVID-related service. We at the NASW took a fairly broad understanding of COVID-related services, and any services delivered by telehealth during this pandemic were by definition COVID-related. We understand now, being at home, the stress that puts on individuals and families having to be at home. So there was no way during this time to work with clients without also working on issues relative to COVID. And had to do some work around making sure that insurance companies were paying it at those levels. Early on, I received a call from LIM because it became pretty clear that while telehealth was a terrific way to move forward in this time, and it's an idea that has been resisted for a long time, a number of folks in the state were either treating professionals who worked up here and lived in another state, treating students who lived out of state with their families but went to school in New Hampshire. And so we were beginning to treat via telehealth people in other states. And the legality of us practicing out of state, if we weren't licensed in those states, became a concern very early on in this crisis, right after the emergency order. We were able to work with the governor's office, make the governor aware of this, and the governor issued an additional emergency order, which provided a mechanism for temporary licensure for any out-of-state professional treating someone in New Hampshire. And many other states, Massachusetts most notably, made similar provisions so that we as professionals could treat people who were actually residing in New Hampshire. Every state hasn't caught up with this, but most of our neighboring states, I believe, have caught up with this. And that was because of the advocacy we were able to do as we understood the concerns early on in this crisis.
John, can I jump in just for just a small piece of clarification for people?
Absolutely.
That while many states have allowed for interstate, the licensing boards have all kind of caught up with, oh, this is going on, and now are asking for people, if you have clients who are in other states and they are allowing for interstate, many of those states are now requesting that you register with them as it's kind of an emergency license. New Hampshire has put this in place as well.
Yep.
So I always recommend that people check out the ASWB.org and look at their COVID-19 page. They have a state by state what the rules are, and often links to how you can register with the state where your client is to be a temporary or emergency licensed person in that state. And while I'm talking, document in your client files why you are doing what you are doing, your procedure, just as you would any ethical dilemma, because sometimes the ethics and the legalities are not matching up. So, and always check with your liability insurance. Okay, now I'm going off. Thank you, John.
Thanks, Lynn. And so that's a very helpful reminder and clarification. So New Hampshire's emergency order does use similar verbiage as long as a professional is in good standing, quote unquote, in their home state. Then they're eligible for the emergency license here in New Hampshire. It's the good standing. And so people are trying to use due diligence to make sure that we don't have questionable professionals practicing questionable ethics. But at the same time, there aren't large hoops to jump through because this is moving very, very quickly. And that's the balance that people have been trying to follow. I put Medicare there by itself. I mentioned previously the NASW was involved initially. They're involved in this phase of it as well. Ultimately, through this crisis, Medicare did authorize audio-only telehealth for Medicare clients. In large measure because a lot of seniors either didn't have video capability, weren't comfortable with video capability. Some people just don't want to be on video, don't want to be seen, don't want their home to be seen, what have you. So that has caught up now. So that my understanding is that all insurers in telehealth accept either video or audio only telehealth, and in large part thanks to our national. So that was the most far-reaching policy consequence during this time. But there are a number of other areas of policy change that were of significant consequence. Child welfare is an area that where most of my practice occurs in. And so this was an area that that was important, it's important to all of us, was on my mind from the very beginning. And I kept asking myself and anyone who would listen to me, people got tired of listening to me, how is this affecting kids? How is this crisis going to affect kids? And it affected kids in a number of ways, but one of the most significant ways that it affected kids is that we moved from face-to-face learning to remote learning. That one act probably had the most profound impact on kids and families of any other emergency order. And I say that because parents couldn't work. Parents had to stay home. Even if parents were working, I'm on meetings all the time with women with young children who, for whatever reason, are primary caretakers. They have a very difficult time having even Zoom meetings because of having to homeschool their kids. I had students in some of my classes who were unable to make certain classes because that was a conflicting time when they were homeschooling their kids. It has added a significant amount of stress to families, to parent and child interactions, but it's also taken the most consequential set of eyes off of our kids, and that's our teachers. We know that most alerts that the child welfare system or child welfare professionals receive about kids maybe being in trouble or families maybe being in trouble, the first alarm is often sounded by teachers. And now teachers were not having eyes on kids. Even where teachers were involved, it wasn't as easy for teachers to understand the dynamics or the consequences of what any particular child might have been experiencing at home. We know from very quick research that anytime there is a crisis, anytime there's a natural disaster, that we see a significant drop in child abuse and neglect reporting. Coincidentally, we also see a significant drop in domestic violence reporting as well as elder abuse reporting. They're all related in terms of the dynamics. In New Hampshire was no different. We saw a 50% drop in calls to the Child Abuse and Neglect Hotline. DCYF data shows a significant drop in reporting in all areas, most notably among schools and teachers. That's where the largest drop happens. But there's been a drop in reporting from police departments, from concerned neighbors, from all of the groups. There's been a significant drop. And so at the outset, we all struggled with how do we make sure kids are safe? How do we make sure families are supported? And how do we make sure if something untoward or something really dangerous is happening, that the system is aware and can engage as close to as normally as it would have engaged during this time? The complicating factor, obviously, is that this pandemic is an ongoing, slow-moving disaster. Most hurricanes, earthquakes are immediate. They're short-lived. The cleanup is long-lived, but the actual disaster is often short-lived. This disaster is evolving day over day, and so we don't know how that long-term is going to impact the system overall, but we do have a pretty good sense of how it's going to impact kids. So one of the first things, first policy changes that was engaged, and we began talking about this in late March. It actually was rolled out in early April, is a family support line. Waypoint, who I also do some work with, Waypoint, formerly Child and Family Services, brought to the governor the idea of a family support line, where there was a telephone line, any family could call in, 15 to 20-minute blocks, to have someone to talk to have someone to ask questions of, to have someone to try to gain some support, crisis support from, and ultimately make referrals if that became necessary. And that rolled out in early April to provide that kind of support. Shortly after that, there were a number of actually one single executive order, emergency order 22, that addressed much of the rest of this. It took all of the existing family violence specialists in the department, and there were several that were part-time. It immediately made all family violence specialists full-time to be able to engage around family violence. Work with police departments, work with mental health professionals, work with families remotely, work with shelters, but made that available in a much broader scope. The Strength to Succeed program, again, is a family support, works to develop family resilience. Previously had been available for families with kids, I believe, up to the age of 6. It was expanded to include all families with children up to the age of 10, to be able to offer that type of support and resiliency building to all families. You know, it's pretty clear to all of us that it is difficult for people who were doing fairly well, both economically and emotionally. I mean, we're quite privileged in that many of us have been able to continue working remotely. There are many people who were not able to continue working remotely. And families dealing with multiple challenges were immediately left without these supports. So building these supports in became the critical part of the policy change, especially in this sphere of child welfare. We also had families in congregate care or in foster care who potentially were unable to have any visits with their biological families because of technological issues. Congregate care and foster care may have computer access, families may not. We're learning the large swaths of this state that do not have broadband access, and the large number of families, over 14% of our families, don't have any computer access at home. And so the technology support became essential to buy phones with data to give to biological families to be able to connect with their children, computers, laptops. So that became a really important part of all this. And the best policy changes are useless if they can't be enacted. So much like transportation is a traditional barrier, technology became a barrier, and the department was able to work fairly quickly to overcome that barrier. And so the third area I want to talk about in terms of policy change is what I call workforce and safety. This is really a grab bag of really important policy changes that occurred during the pandemic, again, almost exclusively through emergency order. And I'm not going to try to give you the numbers. I can work with you to find the numbers if you'd like. my slides, which and notes, which will be available to you, probably contain all the numbers as well, but just gets to be too many numbers. But one of the first emergency orders was to prevent any utility shutoffs in the state of New Hampshire and prevent evictions. Really important for a lot of the folks that we work with that may not be able to pay their rent, pay the utilities. They could at least rest assured that they wouldn't lose their home and they wouldn't lose their power and heat. Unemployment was extended for COVID-19. The state of New Hampshire actually enacted many of the same things that the Federal CARES Act did, but New Hampshire instituted them before the federal government actually acted, and then used the money from the federal government to replace the state money that had been used. But things like paid leave, if you didn't have childcare, if you needed to quarantine because of potential exposure, if you had symptoms of COVID-19 and weren't able to go to work. And the most interesting category, and an important category, are the people who felt uncomfortable working, whether you're in a risk group for COVID, one of the early identified risk groups, and didn't feel comfortable exposing yourself. My son, who worked at Starbucks, they were closed for about 2 weeks in the middle of this, and he's back at work now, but his best friend just did not feel comfortable because of a number of medical issues working. So he just stayed home, and he was paid, actually was paid by Starbucks, but unemployment was also eligible for all these folks. Gig workers, independent contractors, very, very few people in the state of New Hampshire were not eligible for unemployment. I'm hearing stories about some who were having trouble. The vast majority of people in the state were eligible for unemployment and income replacement. Did a lot of work around protecting vulnerable populations, whether that's increased testing in nursing homes, whether that's, there was a lot of work done with the youth shelter in Manchester, the Waypoint Youth Shelter in Manchester, received a grant to buy phones to be able to stay in touch with kids. In large part, that was done with the advocacy of the Child Advocates Office, working to reconfigure our homeless shelters and to bring homeless folks out of encampments into shelters to the extent possible. Shelters are known, and I listened to a testimony last week where a shelter operator said that shelters use every square foot of space and pack residents in every square foot of space. Well, we know the most important thing with this virus is social distancing. And so shelters now can't serve even a fraction of who they could serve before based on social distancing without creating hotspots in every homeless shelter that exists. So there's some work done to use hotels to quarantine at risk or potentially exposed homeless folks, to take over gymnasiums to set up additional emergency shelters, and things like that. There was also additional supplemental money for frontline workers, primarily nursing home workers, but some congregate workers. That's the $300 a week that the governor is paying for folks on the front lines who are in face-to-face contact with clients to try to keep people in work. And finally, one of the more recent emergency orders that the governor issued was an emergency order around Medicaid expansion. Initially, this looked as though all uninsured people were going to be eligible for Medicaid expansion. On a closer reading, what it did is all uninsured people are eligible for COVID testing using Medicaid and COVID-related treatment using Medicaid. Still an important emergency order. Most of, there's a state plan amendment that was submitted relative to this to remove most barriers around eligibility for Medicaid, to include any unemployed people in Medicaid expansion relative to COVID testing and COVID treatment. a very important measure. So there were many, many, many other policy initiatives, policy changes, both with a small p and a capital P. But those are really the key ones that have affected us and affected our practice, affected our clients most notably. And that's how I chose those ones. But most of these didn't just happen. You know, these policy changes, as terrific as they are, happened as the result of a significant amount of advocacy work, some by agencies alone, some by individuals alone, but most in concert with other organizations. And so I want to talk a little bit now about advocacy. And I want to break this into two pieces. I want to break it into advocacy now during the pandemic, and then I want to talk a little bit about how do we plan for the future. When this hit, most advocacy happens at a legislative level. There's very little advocacy from most advocates that happens in the executive branch with the governor. Which is why I stressed so much before how the legislature has been sidelined. As advocates, many of us were talking to one another, trying to figure out how to proceed. You know, what do we do? Do we keep advocating for bills that may not ever happen? What do we do? And it really was a struggle initially because the advocacy world and the typical advocacy practice was turned upside down in terms of who we talk to, who our connections are with, how we gain information. But slowly, by talking to one another and working together, we initially began to identify gaps in service. That was the first thing we noticed. And then there were several different groups that put out letters, open letters, either to the department or in public, calling on the department to fill these gaps the way we normally would in any other time. And the response to it was quite negative by the department. Well, you know, in hindsight, it's pretty clear why it was so negative. We were advocating as though everything was normal. The department was already beginning to operate as though everything was not normal. And it took us as advocates some time to understand that our advocacy really needed to evolve and change during this time to a lot more covert or behind the scenes, as I refer to what types of advocacy. We even had to expand our advocacy into the federal realm. A lot of us don't do federal work. We needed to advocate on a federal level, which is very difficult to do remotely, to make sure that concerns were got to the ears of Congress folks. And finally, we had to advocate with the executive branch, which was something that very rarely in my career have I done any executive branch advocacy. Now, all of our advocacy was done on the executive branch level. So when I said I was attending meetings, I was attending 2 meetings a day, 4 hours a day, executive branch meetings to understand what was happening, to hear what the conversations were, just to be a fly on the wall, to understand what was being considered, to figure out what needed to be framed, what needed to be shaped, and then tried to draw on relationships with legislators to make those things happen. Some blind emails to the governor's staff, and remarkably, emails turned into emergency orders. So we knew they were getting through even though we weren't getting responses. We just kept trying a number of different interventions. But in the end, what became the most consequential were the one-on-one meetings. So we have a meeting on a monthly basis with Joe Ripson, the DCYF director, with a small group I'm part of, to talk about issues related to the pandemic. Joe and I also text quite frequently. When issues come up, he'll either alert me, I'll alert him, tell him what we're thinking, what we want to do, and try to work together. The department, Joe and Christine Tappan, I know they have regular contact with the child advocate um, to try to jointly identify and to brainstorm what the issues are and how we need to respond to them, to at times push the department to do things, but not in a public way. It's all a behind the scenes way. And this has really paid dividends. You know, this is how the warm line happened. This is how much of the child welfare reform happened, and the emergency orders around child welfare. That's how much of that happened. With through these conversations, um, they percolated up to the governor's office and ultimately came out as policy change. But it was a real struggle to figure out who was making the decisions, especially with the legislature suing the governor. It was a struggle to understand who was making the financial decisions, who was making the policy decisions, and who the hell could we talk to try to frame this, since we had never worked in that sphere particularly before. That was and is still a crisis, still not a crisis, still an issue to understand and to navigate those questions. But we've already begun pivoting, and I showed you the data before. We're not out of this pandemic by a long shot, but we've already begun pivoting to, okay, so what happens next? How do we plan for the future? There are some significant policy changes that have taken place. Things like telehealth as part of the normal way of delivering treatment. Moving kids out of congregate care. There are still too many kids in congregate care, whether it's the SUNY Youth Services Center or whether it's group homes. But admissions are down. Some kids have gotten out. We're beginning to understand that we can't use congregate care in the way that we did before. We need to find other ways, which means more community-based treatment, which is exactly where we need to be going anyway. The expanded unemployment, you know, what we know from change theory, what we know from policy theory is that the most consequential and typically effective policy change happens in crisis. We as advocates try to capitalize on small crises to make policy change that will affect systems. Here we have a wide-scale, universally understood crisis. And we have seen significant policy changes as a result of this, much of which has been fought by opponents for years. Telehealth should have been a modality a long time ago. It has been fought against by lots of groups. So the question is, we have accomplished these policy changes, but as I said, when the emergency declaration goes away, all of these emergency orders go away, how do we start now to make sure that telehealth stays as a modality, that kids are treated in the community and not in congregate care to the extent possible? How do we make sure that we, excuse me, that we modify and update eviction and utility shutoff orders that affect our clients? How do we modernize unemployment insurance to be more humane? How do we affect childcare the way we're doing now? How do we keep that going forward so that families aren't spending much of their income to afford quality childcare? And that's where we're beginning to pivot to now. How do we keep all of these things in place? And I'll tell you, it will be a challenge. There will be a lot of opponents to people will want to go back to the way things were, want to go back away from telehealth, only paying for in-person, go back to congregate care. And there'll be an initial backlash whenever this crisis ends. But it's our work now in the midst of the crisis that may enhance our ability to keep these changes permanently. I jokingly said to Lynn last week, anything we do for 6 months or more becomes a habit, and it's almost impossible to go away from it. So one of the things that I'm hopeful is that these policy changes will begin to be seen as the norm, and their benefit will be understood. But hope alone isn't going to make this happen. We're going to need to work with other professionals, with other advocates, with other groups who we might not typically work with. So I'm beginning to work with some primary care health providers, beginning to work with community health clinics. We need to find these non-traditional partners. We need to engage insurance companies now in this conversation. We need to engage as many disparate groups as we possibly can to talk about the benefit of these policy changes, so that while they still may need legislative action, we can be sure that the policy changes, in fact, will sustain going forward. I mean, I can't think of anything more consequential for our clients throughout the state, particularly in rural areas throughout the country, than telehealth. The fact that people don't have to drive for a doctor's appointment. People don't have to choose paying for transportation. People can get to their appointments where they couldn't before because of transportation. Telehealth is an incredibly consequential change that we need to keep in place, but so aren't all the other changes that I talked about. And if we wait until the pandemic is over and things snap back to where they were, it'll likely be too late to make sure that these things happen and stay in place. And so that's why the work now is going to be so important. We're going to be in this situation probably for several more months, to a greater or lesser extent. There'll be more and more freedom of movement, more and more things open. But the emergency order likely will be in place into the fall. And so we do have a couple of months to engage some of this work, but it is going to take all of us, not just us macro folks. It's going to take clinical folks as well, talking with your contacts, talking with your insurance contacts, working together to be able to make sure that these policy changes stay in place, ultimately to the betterment of our clients moving forward. But the one thing that we do know through all of this is that we will get through this, but we will only get through all of this together. This is a slide that I'll say for you to go through. A number of resources, the most notable ones in the state of the Health and Human Services, the emergency order website, all the other task forces I mentioned that you can utilize to find more information about any of the things that I talked about today. And with that, Lynn, I'm right on my mark. I hope to be to questions by about 9:30, and here it is 9:30.
Look, here you are at 9:30, ready for questions.
Let me stop sharing so I can see people. That's better.
There we all are. I know that there was a question about the co-pays, and some insurances are covering co-pays, some are not. It's one of those things that is still kind of being worked out with the insurance commission. So I don't want to get into a whole long conversation about which insurance companies are doing what right now, but I'm going to open it up for anybody to ask questions.
Yeah, and I can say that, Lynn, you know, it's an interpretation of the emergency order that they can't charge copays and deductibles. I know you had reached out to me, and we talked to Blue Cross Blue Shield, that I believe has stopped charging copays and deductibles, but they did say to us that they had to modify their computer systems, because their computer systems were written for a different type. So I would encourage people, if they haven't, to reach out to insurers to reference the emergency order. And as I said, that everything we do these days is COVID related. I challenge anyone to tease out COVID related engagement from any other type of engagement we have with clients these days.
Right, and also the recognition that Insurance companies, when there's a legislative change to insurance, insurance companies ask for 6 months in order to get their systems,
Right.
their billing systems up to date. And they had what, like a week. So
Yeah.
their systems are, and of course it's not just, oh, this is the rule in New Hampshire. It's also, what's the rule in Massachusetts? What's the rule in Georgia? What's the rule in, so my understanding is that they're getting caught up, but that there's still lots of mistakes. And so I know on your end, if you are billing insurance, there's a lot of back and forth,
And this is why the clawback is so important. You know, we as a chapter have been working on clawback legislation that right now insurance companies by statute can claw back payments made in error for 18 months after service date. We were trying to change that to 12 months. That actually was changed to 6 months in the legislation. And that legislation is well, one of the things we're trying to figure out what is happening with the legislature to keep that moving forward. And actually my argument to legislators has been, listen, in this time of crisis, we're really concerned that a year from now, insurance companies are going to try to claw back money paid during the pandemic. And so all of you are small businesses or work for small businesses. That creates significant instability in the small business community. And that's the argument that I'm using to make this an essential bill to keep it moving forward.
Moira, do you want to come off of mute and ask your question?
Sure, thanks, Lynn. I see that Larry Schulman has asked a similar question.
Yes.
You know, been some qualifying for hazard pay or enhanced stipends for people who work in long-term care, for people who are selling alcohol at the state liquor stores. And I just, you know, our office has certainly advocated for the caseworkers in child welfare to be provided with hazard pay without results. And I just wonder what other efforts have been made to protect social workers who are not just in child welfare. There's certainly people going into families' homes or elder assessments and other such things. And I'd like to hear what's been happening, and it'd be great to hear what the people in the group think about this issue as well.
So I'm glad you brought that up, Moira. As of yesterday, the Gopher group that I referenced before, the legislative Gopher group, issued recommendations to the governor on spending of the CARES money. One of the recommendations that we were able to get into that list was including child protective workers for the frontline worker incentive, the $300 incentive. Now, it's important that that's not binding, but they have recommended unanimously to the governor to include CPSWs in that. So that's another way of going at it. As far as protecting frontline workers, much of the focus around protecting frontline workers has been around not going into people's homes when that wasn't necessary, telehealth. But the other piece was around personal protective equipment. And on that front, so social workers as well as other mental health professionals, in some areas were not seen as requiring PPE initially, that they didn't have PPE. Most agencies didn't have a significant amount of PPE, and they were not able to get it early on in the crisis. And people wondered, why do they need it? It has become clearer through all of these meetings why anyone meeting with clients needs personal protection, at the very least a mask. But in other cases, gowns and gloves and more significant personal protective equipment. And there appears to be a fairly robust supply at this point of most types of personal protective equipment. My wife works in a hospital in Nashua, so I get from the hospital's end where things are at. And the most recent thing is there's still a shortage of surgical gowns. That's apparently getting better, but most other types of PPEs, including gloves and masks, are more readily available. And so that's where most of the work has gone. The $300, quite frankly, came from the governor. And that came about out of a fear that there would be no workers in nursing homes. So as nursing homes became hotspots, workers needed to quarantine because of exposure. There were beginning to be a large number of other workers who were refusing to go back to the nursing home because they qualified for unemployment because they didn't feel safe, and because unemployment was paying at a $600 supplement. There became a concern that people were going to choose to be unemployed over working in a risky situation. And so that's where the governor's idea came from of a $300 bonus. Most of us felt it was far too little. Nice gesture, but far too little. And really the best thing that could be done was to really protect the sites, to protect the seniors, protect the workers through testing, through equipment, through social distancing where possible.
John, I'm going to step on my soapbox here for 2 minutes, and apologies to those of you who've heard me step up on my soapbox about this before. One of the reasons why I wanted for John to do this presentation is not only about the things that are happening right now, but really for us to be looking at the future. And when you look, and for those people who are getting that $300 to stay on, it's to actually bump up what they make in a week by probably around $100. John and I were talking about this before. That $600 unemployment that people are getting is $15 an hour. It's $15 an hour, which means that it is more than people who are making minimum wage or close to minimum wage. So when we're thinking about advocacy for future policies, maybe $15 an hour minimum wage should be among that. We're seeing so much that's happening right now that is to support people, but these are things that should be in place at all times. People should be making $15 an hour. People should be able, when it's in the best interest of the client, to access telehealth for any health, and the provider should be able to be paid the same reimbursement rates as in person.
You're right. This is a once in a generation opportunity.
Yeah. And so, I mean, another thing that I come back to is schools are having to do remote learning. And so schools are having to scramble to say, oh, we have kids that don't have devices. We have kids that don't have access to internet. They're going to the McDonald's parking lot or the church parking lot in order to get access to internet. Guess what? It's happening right now because all kids are doing distance learning, but all of our students, all of our children should have access to high-speed internet and devices. This is the 21st century. They should have access.
One of the conversations in the Gopher meeting is to build out broadband through 100% of the state.
Right.
About a $44 million project that has unanimous support in the Gopher group. They're waiting to see if the money's still available after they do all of the other essential things, such as testing. But that is certainly an area that has had significant conversation.
Okay,
but beyond that, you're right, devices.
Right, and I know a lot of our attendees today are social work students, and almost all of you were social work students. We know that major social change happens during a crisis. Great Depression, 9/11, but if you think about the Great Depression, Frances Perkins, right? Who's our next Frances Perkins? And how are you going to be Frances Perkins to help solidify these changes that have taken place, so that they're not just happening during a crisis, but are recognized as, oh, these are things that meet people's needs. and should be in place regardless.
Yes. Well, and that's what I mean when I say a once in a generation opportunity. I mean, I said before, change, and especially significant change, only happens in a crisis.
Yeah.
You know, it is often ethically challenging to capitalize on crisis, but that's when change happens. And this, when I say it's a once in a generation opportunity, it's a once in a generation opportunity to address issues like income inequality, um, the extensive number of uninsured people, the um, you know, the number of folks who live in substandard housing or no housing, or um, go through apartments because they're continually evicted, losing utilities, don't have basic income. You know, Nixon, who's not typically a liberal hero, but Nixon, early on, when he created EITC, his argument for creating EITC was that you shouldn't work and be poor. And we have become as a society numb to the working poor, which is growing larger and larger all the time. You know, why I hear constantly from teachers, well, parents don't come to talk to us about their kids. Well, have you ever considered maybe they're working 2 jobs to be able to provide, to pay childcare, to do whatever they have to do? So this is the one opportunity in our generation that we are likely to have to make a significant impact on these issues. And it will be a Herculean lift because we still have large numbers of people who think the poor are just lazy. And so we have to figure out a way through this crisis to engage the people who now have a new view of what it's like to be unemployed, of what it's like to go to a food bank, much like the way Roosevelt was able to push through New Deal programs, because people understood they were poor through no fault of their own, and maybe other people were in a similar situation.
I'm seeing lots of comments being put in the chat. Stephanie Savard, can I ask you to take yourself off of mute? You have such a unique perspective on homeless populations.
Yeah, sure. Excuse me. Yeah, I think I just wanted to, there's a lot of back and forth about what to do about individuals who are homeless who are in the camps. And the CDC actually really recommends that I know this sounds crazy, but we encourage people to stay in the camps right now because many of the shelters cannot ensure the social distancing that's needed. Shelters are working very hard to create that, but as we're creating it, we're decreasing our beds as a result. And so we're having this, dichotomy of a problem of we're protecting those who are in the shelter from COVID, but yet you have folks that are having to stay in the camps. And so at least in Manchester, we've been working with the state to supply what the camps need. So that's food on a daily basis, twice a day. That's porta potties, that's hand washing sinks, you name it, which is creating this society community pushback of, wait a minute, what are you doing to encourage people to be homeless on the riverbanks? And so it's been a heck of a political tug of war. I keep saying, but CDC says. That's my biggest mantra, and it's probably the most important one that we can say, because I know that the shelters across the state are working hard and nobody wants to put people in the camps. So it's just a crazy dichotomy that we need to keep working with our communities to understand, because businesses and citizens are really frustrated right now with the camps that are popping up, particularly in Manchester, but in Concord as well. They're just a little more hidden in Concord.
That's a great point, Stephanie. And it's not a space I do a lot of work in or really have a lot of knowledge about. So I'm glad you brought that up. I know the commissioner has talked about trying to create several overflow shelters because of the lack of space now with social distancing. And what she's been, so that you want to further this dichotomy, people don't want homeless folks in camps. But every time the department has had a site for a new emergency shelter, there's been pushback from the communities that they don't want an emergency shelter.
Correct.
So it's a real struggle. They've essentially commandeered hotels for quarantining of folks in some places. But it's a great issue. It's a great question. It's a really vexing issue. I wasn't aware that was the CDC's guidance. That's helpful to know.
Yeah, and the Gopher is definitely looking at additional funding specifically for shelters, but also for housing. It looks like they just put in a 10 million recommendation for shelters and a 40
Mhm.
million for housing. So both really, the 10 million could go really fast, unfortunately, but still huge boosts to support these causes.
And Gopher just asked yesterday for I think one of the Gopher groups is recommending that. The legislative group didn't recommend that, but the legislative
Yep.
group has asked for more testimony to understand the homeless issue and how best to address that, as well as the need for emergency housing. So they have expressed an intent to fund that. They're just looking for some more information. So it's, again, it's important. We need to create a new normal that really represents our values. And some of this funding may help with that. It's not enough, but it may begin to move in that direction.
Yeah, we definitely know our shelters can't go back to what they were. And that's scary because how quickly do they have to go back because our winter is not far away.
Exactly.
John, you talked about how advocacy right now looks a little different. So how might we advocate as individuals at this point, recognizing that all the people on here are content experts on their particular demographics, right? The clients that they serve. How can people advocate?
So this is actually an easier question now than it would have been a few weeks ago. A few weeks ago, I would have looked at you dumbfounded and said, I have no idea. I think the most effective thing that people can do now is several-fold. One is to reach out to one of the two Gopher groups, or the Governor's Reopen New Hampshire Commission. So the Reopen New Hampshire Commission is looking at how to safely reopen the state. They're the ones who issued universal guidelines and guidelines for businesses reopen. There are two different Gopher groups. One is a stakeholder board, primarily nonprofits and business leaders. And then there's the legislative group, which is all legislators. They're finite groups, though. And they are the groups that today are making the decisions, or at least making the recommendations. And they have been very engaged in, not every one of them, but the groups have been engaged in hearing from all kinds of different groups, from homeless experts to New Hampshire legal assistants around the legal work they do to help clients who are being evicted, to businesses, to schools, to mayors, nonprofits. Capital Center for the Arts came in and testified. They have really been trying to get their arms around the scope of the issue, of the problem, and how best to address it, both from a policy and from a financial perspective, even though they've been more focused on financial. The governor has staff at each of these meetings as well. And so that's the other way, is by engaging these groups, you're also engaging some of the governor's staff. I wasn't joking when I had said, Lynn reached out to me about the out-of-state issue for telehealth. I know some of the governor's staff from years ago, but don't have no ongoing relationship with him, and didn't even know the guy's email. Found his email and fired off an email. Never heard from him. I got back to Lynn and said, yeah, I haven't heard from him, Lynn. I don't know what's going on. And 2 days later, there's an emergency order addressing the topic that we had been talking about. So people are listening. People are really grasping for expertise in all of these areas. And that's why us as experts can be so consequential right now in talking to some of these groups. I'm trying to get through the chats. The problem I'm having is people wrote a lot, and it's really interesting. So I get trapped in the verbiage and missing the question on some of these. So Holly asked about the issue of insurance carriers not being able to charge out-of-pocket costs and having to prove COVID. It's an interpretation. It is good press for insurance companies to interpret broadly right now. The governor's emergency order is written broadly. It doesn't say anytime you can prove COVID. It says for the treatment of COVID. At the end of the day, it's going to be really difficult if an insurer refuses to, beyond public shaming of the insurer. But uh, you know, those are the I listed out the arguments that I use. Um, Everything is COVID. I mean, who's had a conversation in the last week that hasn't either begun with, included, or ended with the pandemic? You know, my salutation used to be, you know, have a great day. Now my salutation is be safe and wash your hands. It is crazy how much our lives have been flipped upside down. And that's the spirit that I say that nothing we do avoids dealing with COVID or the pandemic. But again, it's, you know, it's the enforcement will be difficult if the companies are refusing.
And I think probably the bigger prize, if you will, and I hate thinking of anything as a prize, is not about the co-pays. It's about the telehealth at the same reimbursement rate as in person. That's the long-term goal, because we know that the insurance companies are paying what, 70% of in person, which
Yep.
Every clinician I've talked to who is doing telehealth lets me know it's exhausting. It is a whole different way of working, and it is sometimes more challenging. You have to work harder to get those nonverbal cues. You have to work harder to see how people are doing.
Absolutely. I mean, I've worked remotely for years. I've never worked so hard as I have in the last 2 months. It's really emotionally taxing in a lot of ways. So there's a couple of comments, and I keep losing them. Nancy. And Nancy, feel free to unmute yourself. Nancy's comment is that not all community mental health centers are funded equitably. Northern Human Services, as she understands it, doesn't have enough computers or people to work from home. We need to fund CMHCs equitably. I think that is absolutely true, and I think that is an age-old problem that budget writers, most budget writers come from the southern part of the state. That's where most funding goes. That's where most people are. The northern tier, which is where Northern operates, has fewer people, but a much more, geographically, a much larger area, don't tend to get funded. They get funded based on the number of people, not on the amount of work they need to do in terms of travel. I will tell you, Nancy, that Representative Erin Hennessy is on the Gopher group. She's on the legislative Gopher group. Erin is great. Erin is a good friend. She's a Republican, which means we don't agree a lot, but she is a tireless advocate for the North Country. There is never a conversation about funding that she does not say, excuse me, we need to make sure the northern tier of the state gets funded properly. Every single conversation. So Nancy, I would encourage you to reach out to Erin Hennessy directly. If you can share with her specifics, or someone from Northern can share with her specifics, she will take those to back to Gopher to fight for, as well as she's on the finance committee, so she'll be writing the next budget. She will take those to folks to try to create more equality across the CMHCs.
Thank you, John. I consult with some of the clinicians at Northern, and they have a caseload of 80 clients a week, or 80 clients. They are often booked out 3 to 6 months waiting list. I live in the same county and work in the same county. I used to work in community mental health. A lot of us in private practice get referrals from the mental health center because they are understaffed, underfunded, and they do not have enough of what they need, and it's ongoing. I've not heard of Erin, but I will contact her, and I thank you for giving me her name.
So if you're not familiar with the General Court website, you can just type in New Hampshire General Court. It'll bring you to the House and the Senate. Each body, House and Senate, has a link that lists all their members, and they list the best contact number. Most House members list home contact numbers. So you can actually feel very comfortable to pick up the phone and call her at home. You know she's home. But you can also email her. My guess is she's getting lots and lots of emails, so a call might be more direct if somebody wants to have a conversation with her. But she's great and she's approachable. So I would recommend that.
Thank you.
So Stephanie Emons is talking about access to broadband is still an issue. I was amazed at one of the Gopher meetings. They were talking about only 92% of the state has broadband access. Only 86% of households have electronic access from home, either because of access to equipment or because of broadband. Schools have done a lot with remote learning, excuse me, to increase that number. I don't know what it's at now. The state needs to do the rest to at least initially make sure broadband is available, because there are a number of areas, I drive through them all the time when I lose my cell service, that don't have internet access. And I think that is critical, both from a connection issue, a telehealth issue, but it's also from an economic issue. It is critical that businesses can operate online, which is really the way of doing business these days in all areas of the state, or else we're hamstringing our economy as a state.
Hey, John?
Yeah.
If you could answer one more question, and then I'm going to take it over and give the last of the logistics, because we are coming to 10 o'clock. How do people find out who's on the Gopher group?
Don't you love that acronym?
I know.
And I actually, when I was going through the context, I found myself speaking very quickly in the context. I looked at my watch. I'm like, my God, I'm going to run out of things to talk about, which is never a problem for me. So the fact that we're out of time is kind of interesting. So I will send the slide deck that I created to you and Tori, Lynn, if Tori could post it and let folks know where. There is a link in the slide deck to Gopher. But if you go to nh.gov and go to the governor's page, there is a link on the right-hand side and it's Goffer is how they're spelling Gopher, the Governor's Office for Economic Relief and Recovery. In there are two different advisory groups. There's a legislative and a stakeholder advisory group. If you go to those links, they're hard to navigate, but in those links, one of the early press releases lists all of the members of each of the two groups. And if anyone has trouble finding it, please reach out to me and I'm happy to help you. Hang on. My car broke down the other day. It's been in the garage for 3 days, and the garage chose right now to give me a call in the middle of this presentation. So I have to tell him no right now and call him back. But yeah, so the Gopher group, and on that resource page, there are links to IHME, which is one of the models of the virus. There's the Johns Hopkins ongoing tracking of cases. There is the DHHS COVID page that they update every day in terms of cases, in terms of, and links off of there for all of the emergency policy orders by the department. Some of them are embedded in the menus, but they're all linked off of there. It's a very useful website for people to have, as well as our own national has a useful website, which, full disclosure, that's where all the graphics in this slide deck came from, was from the national's COVID resource website. So take a look at that as well.
Yeah, and just again, it's Goffer.
Correct.
If you plug in Gopher, like the small furry animal, you don't get it. So,
but go to nh.gov and look for the governor's page, and it is a link on the right-hand sidebar of the governor's page.
I'll also NASW New Hampshire is you know, if you're a member, you get all of our emails to members and advocacy alerts. Also put it on the Facebook page, stuff not only from New Hampshire, but also from national. So you may want to check that out. Okay, back to, and this webinar is being recorded and it will be up on the website probably in the next day or two. Now for the logistics of CEUs. If you have purchased CEUs and you have not yet put your name in the chat, your full name in the chat, you will be receiving your evaluation very soon, and you'll be sending it to Tori and she will send you your CEU certificate. Other than that, thank you so much, John. We appreciate it.
No, it's really, it's always rewarding to talk to a group of clinicians about policy.
Yeah. It's, yes. Whether you're micro or macro, you are content experts. And I've said it before when I've heard a representative say, I got 10 calls about this. I got 10 calls about this. 10 calls moved the needle. So don't forget the power and the responsibility that you all hold. And with that, I'm gonna sign off. Thank you, John, and all of you have a great day. Thank you so much for joining us.
Thanks. Bye-bye.
John,
Lynn,
thank you very much.
you're welcome. It was fun.